This is our last video for today on coronavirus safety. If you are worried about this killer virus, let go of worry and arm yourself with facts. Sit tight and get answers to frequently asked questions by concerned citizens of the world. Should I worry about COVID-19? Illness due to COVID-19 infection is generally mild, especially for children and young adults. However, it can cause serious illness. About 1 in every 5 people who catch it need hospital care. It is therefore quite normal for people to worry about how the COVID-19 outbreak will affect them and their loved ones. We can channel our concerns into actions to protect ourselves, our loved ones and our communities. First and foremost, among these actions is regular and thorough hand washing and good respiratory hygiene. Secondly, keep informed and follow the advice of the local health authorities, including any restrictions put in place on travel, movement and gatherings. Who is at risk of developing severe illness? While we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer or diabetes appear to develop serious illness more often than others. Are antibiotics effective in preventing or treating the COVID-19? No. Antibiotics do not work against viruses, they only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of COVID-19. They should only be used as directed by a physician to treat a bacterial infection. Are there any medicines or therapies that can prevent or cure COVID-19? While some Western, traditional or home remedies may provide comfort and alleviate symptoms of COVID-19, there is no evidence that current medicine can prevent or cure the disease. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials that include both Western and traditional medicines. Is there a vaccine, drug or treatment for COVID-19? Not yet. To date, there is no vaccine or specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Most patients recover thanks to supportive care. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of your elbow or tissue, and maintain a distance of at least 1 meter (3 feet) from people who are coughing or sneezing. Should I wear a mask to protect myself? Only wear a mask if you are ill with COVID-19 symptoms, especially coughing, or looking after someone who may have COVID-19. Disposable face masks can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. There is a worldwide shortage of masks, so WHO urges people to use masks wisely. How long is the incubation period for COVID-19? The incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 1 to 14 days, most commonly around 5 days. These estimates will be updated as more data becomes available. Can humans become infected with the COVID-19 from an animal source? Coronaviruses are a large family of viruses that are common in animals. Occasionally, people get infected with these viruses which may then spread to other people. For example, SARS-CoV was associated with civet cats and MERS-CoV is transmitted by dromedary camels. Possible animal sources of COVID-19 have not yet been confirmed. To protect yourself, such as when visiting live animal markets, avoid direct contact with animals and surfaces in contact with animals. Ensure good food safety practices at all times. Handle raw meat, milk or animal organs with care to avoid contamination of uncooked foods and avoid consuming raw or undercooked animal products. Can I catch COVID-19 from my pet? While there has been one instance of a dog being infected in Hong Kong, to date, there is no evidence that a dog, cat or any pet can transmit COVID-19. COVID-19 is mainly spread through droplets produced when an infected person coughs, sneezes, or speaks. To protect yourself, clean your hands frequently and thoroughly. How long does the virus survive on surfaces? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. This may vary under different conditions, for instance, type of surface, temperature or humidity of the environment. If you think a surface may be infected, clean it with simple disinfectant to kill the virus and protect yourself and others. Clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, mouth, or nose. Is it safe to receive a package from any area where COVID-19 has been reported? Yes. The likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus that causes COVID-19 from a package that has been moved, traveled, and exposed to different conditions and temperature is also low. What do I do if I have recently visited areas where COVID-19 is spreading? Self-isolate by staying at home if you begin to feel unwell, even with mild symptoms such as headache, low-grade fever 37.3 degrees Celsius or above, and slight runny nose, until you recover. If it is essential for you to have someone bring you supplies or to go out, for instance, to buy food, then wear a mask to avoid infecting other people. Avoiding contact with others and visits to medical facilities will allow these facilities to operate more effectively and help protect you and others from possible COVID-19 and other viruses. If you develop fever, cough and difficulty breathing, seek medical advice promptly, as this may be due to a respiratory infection or other serious condition. What can I do to protect myself and prevent the spread of disease? To protect yourself, stay aware of the latest information on the COVID-19 outbreak, available on the WHO website and through your national and local public health authority. Many countries around the world have seen cases of COVID-19 and several have seen outbreaks. Authorities in China and some other countries have succeeded in slowing or stopping their outbreaks. However, the situation is unpredictable, so check regularly for the latest news. You can reduce your chances of being infected or spreading COVID-19 by taking the following simple precautions. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 1 meter (3 feet) distance between yourself and anyone who is coughing or sneezing. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Avoid touching eyes, nose and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and can make you sick. Make sure you, and the people around you, follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu and COVID-19. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention by calling your local health authority. Follow the directions of your state and federal ministries of health, as they have the most up-to-date information on the situation in your area. This will protect you and help prevent spread of viruses and other infections. Keep up to date on the latest COVID-19 hotspots, cities or local areas where COVID-19 is spreading widely. If possible, avoid traveling to places, especially if you are an older person or have diabetes, heart or lung disease, as you have a higher chance of catching COVID-19 in one of these areas. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. This is why it is important to stay more than 1 meter (3 feet) away from a person who is sick. Can the virus that causes COVID-19 be transmitted through the air? Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. Can COVID-19 be caught from a person who has no symptoms? The main way the disease spreads is through respiratory droplets expelled by someone who is coughing. The risk of catching COVID-19 from someone with no symptoms at all is very low. However, many people with COVID-19 experience only mild symptoms. This is particularly true at the early stages of the disease. It is therefore possible to catch COVID-19 from someone who has, for example, just a mild cough and does not feel ill. Remember to subscribe to the channel for more natural health news and COVID-19 update. Visit our website at naturalhealingguides.com for more natural health guides.